I'd like you to meet Dr. Anderson. He's the member of our team I was telling you about who's worked a lot with people who've been struggling with trouble with sleep. And usually when I bring a new team member in to help a patient work on some symptoms that they're having, I do a summary of what we've discussed already to bring him up to speed and let you have a chance to interject or add anything that I'm missing.
Okay.
Is that okay?
Yep.
So Caitlin came in today because she's really been struggling quite a bit with sleep recently, particularly falling asleep when she first goes to bed, kind of going through the thoughts of what happened during the course of the day, what has to happen tomorrow, and going through those seems to be keeping her up and making it more difficult to fall asleep. And then once she sleeps, it sounds like the quality of sleep is not as good as it used to be for her.
Yeah.
And it's getting to the point where during the course of the day, because she's getting such poor sleep, she's really having trouble getting things done at work and doing what she has to get done throughout the course of the day.
Okay.
You tried some things on your own before you came in to talk to me that you were trying to use to help with sleep. You tried NyQuil?
Yeah, I was taking NyQuil and it worked pretty well at first, like at least helping me fall asleep. But I kind of felt groggy and weird during the day.
Yeah.
And I kind of stopped taking it about a week ago because I wasn't even doing anything anymore.
So in the course of our discussion, we talked a little bit about some immediate ways to help get better sleep, because Caitlin's getting to the point where she feels that she just needs something, get some good nights of sleep, kind of get back on the right track. So we've talked about some medicines, and we think we're probably going to use that as part of taking care of this issue. But the other concern was that we talked about that not being a good long-term solution. So maybe short-term it's a good intervention, but really needing something else to help a little bit more. Does that sound right? Is there anything else that you'd add to that?
No, we had also talked a little bit about, Dr. Carter was asking me a little bit about my sleeping, about my room and stuff like that, and I told her that we do have a TV in the bedroom, and my husband and I like to watch something like a show or a movie or something when we fall asleep, or before we go to bed, and she was talking about maybe wanting to take the TV out, but I don't know, we've had it for a couple of years and I've never had trouble sleeping before, so I don't really feel like the TV is enough, or I don't know that that'll really make a difference, so, and my husband really likes it, so I'm kind of feeling like I would like to do something other than that, if there is anything.
Yeah, no, certainly. I mean, that's very, this summer has been helpful, and especially what you're saying there at the end, it sounds like messing with your TV is not a direction that we want to go in. So usually when we are trying to understand sleep or help set up something to help somebody who's having poor sleep, there are kind of three components that factor into sleep. One is the physical process or the physical processes that occur when someone's trying to sleep or get in the way of having bad sleep. And it sounds like you've set up an intervention, at least for the short term, that can deal with that, namely the medication. The environment, as it seems like you're kind of aware of, can play a role in sleep. And it sounds like what I hear you saying is the environment right now hasn't changed and has been a good environment for sleep for you and for your husband for a while. And so that's maybe not where we want to spend a lot of our energy trying to figure out something for you. The third component is the psychological or the mental, the thought part of sleeping. And what I understand from hearing Dr. Carter's description, and it sounds like this is fits pretty closely with what's going on to you, is that is something that might be interfering with your sleep, and so something that we could give to you that would help address those racing thoughts would be useful. And what I have in mind today, if it's something that would be okay with you, is an exercise that addresses the thought part that can help to slow your thoughts down a little bit and distract a little bit from the racing about what happened earlier in the day or what it is that you have tomorrow.
That would be good.
And also addresses a little bit of the physiological aspect. So it could be something that could supplement the medication that you and Dr. Carter are already discussing. Is that okay with each of you? Would you take a look at this? Good. Okay. So the exercise I have in mind is a breathing exercise. And it works best, especially when you're first starting off. I'll demonstrate it for you here. If you sort of lean back in your chair, and I'll ask you to do this too in a moment, and take one hand and put it on your stomach your
Mhm.
belly, and one to put it on your chest.
Okay.
And what we're focusing on here is trying to get away from breathing from how most of us usually do it, which is from our chest, and focus on breathing instead. Regular basis in order to be able to use it in an effective way when you're trying to get to sleep.
Okay.
Do you think there's a couple of times through the course of the day that you could, have a couple minutes to just practice it when you're not, doing something that's either stressful or like at the end of the day?
Yeah.
Maybe first thing in the morning or somewhere where it would fit for you.
Mhm. Yeah, I can do that.
Okay. And I think, I like the way that this is starting to come together here, because it seems like we've got something for the short term, because, sleep is, it's an important component of
Yeah.
life for most of us, if not all of us. And if your sleep is bad, it's not just that you're feeling a little bit tired the next day. If you're, again, like most of the patients that we see here, or most people, it can affect your relationships, it can affect the way that you work, you do things at work, it affects everything. And so we've got the medication to help in the short term, we've got this exercise to practice to give you something that you can use over the longer term. Now, ideally, if this is something that each of you are comfortable with, what I'd like to recommend is that you and I set up a follow-up appointment to meet again sometime, I don't know, in the next week or two, to check in, see how this is going with the practicing. Ideally, I would recommend that you try to practice this daily for 10 minutes or so each day over the next week or so. I'd like to meet up with you again, like I say, sometime in the next week or two, see how this is going, see how in general your sleep is going. And if it is not enough, I have some other similar things that we can try, that we can add to continue to work on this with you.
Okay.
And then usually what I would do is probably have you come in, if you see Dr. Anderson in a week or two, maybe see me a week or two after. But we work very closely together in the office, so if he touches base with you, something's not working, we can either change something over the phone, he and I can certainly
Okay.
talk in between. And that having been said, if you have any questions or worries that come up between those visits, knowing that we're available to talk with and troubleshoot.
Yeah, and I just want to jump, certainly supplement that. What about right now? Do you have any questions, concerns, anything that you want to add right now to what it is that we're trying to put together?
I don't think so. I mean, my big concern was feeling like I just need to get a good night's sleep now, because I'm starting to be half asleep at work and people are starting to notice. So I think the medication will help with that.
Yeah.
But I understand that probably for the long term that's not the best solution. I don't want to be taking medications forever to sleep either. So
Yeah.
for now it sounds good. I'll try
Okay.
that out.
Okay.
So we'll set up those visits and we'll have you come back in a week or two and then following that with me.
Yeah,
Okay.
sounds good.
Fantastic. Well, it's been
Okay.
great meeting you. I look
Yeah,
forward to
thank
working
you.
with you.
Nice
Okay.
to meet
I'll
you.
see you soon.
All right, I'll see you later.